Hello viewers, today we will discuss about the cancer care during COVID-19 pandemic. I am Dr. Mahibul, Senior Consultant Surgeon, Department of GI and Hepatobiliary Oncology, Oriental Cancer Institute, Guwahati. So whatever we will discuss that will be discussed as per ESMO guideline, that is European Society of Medical Oncology. The ESMO has prescribed a COVID-19 guideline that is published on April 8, 2020 for the cancer patients. So let us assume who is at specific risk for COVID-19. So far, no systematic report are available about the higher incidence of COVID-19 infection in the patient with the cancer. However, the available data indicate that older patients are more vulnerable, particularly when are underlying health conditions such as chronic lung disease, cardiovascular disease, diabetes mellitus, chronic kidney disease, and active cancer. So, who are the people at risk actually? In the cancer patient, these people are specifically having the higher risk for the infection of the COVID, to get COVID infection. That is the patient who received chemotherapy, who is receiving chemotherapy or received chemotherapy within the last 3 months. Patient received extensive radiotherapy, patient who has done bone marrow transplantation or who is still taking immunosuppressive drug, and specific cancer like leukemia, lymphoma, and multiple myeloma. The ESMO medical oncology has divided into the patient category into 3 tiers, that is tier 1, tier 2 and tier 3. Tier 1 is high priority. This group patient of include whose life is who is in life-threatening condition, like clinical unstable patient, or who is planned treatment is likely to result in significant benefit or prolonging life, improving the quality of life, making the treatment in a higher priority. And the tier 2 is medium priority. This group includes the patient with a serious condition but no immediate life-threatening condition, where a short delay of treatment can be considered. Usually in the 6 to 8 week delay is usually done. And in the low priority, whose treatment is not anyway going to affect the patient condition, and this patient usually likely to be or maybe such type of patient where there is treatment will not elongate the life or not improve the quality of life. In such type of patient, the treatment usually deferred. So in the adaptation of surgery plans, actually, in most countries, the non-essential surgeries are being postponed for the duration of the COVID-19 pandemic, or the patient with the cancer has a potential risk or progression following the delay of surgery to be balanced against the potential exposure of coronavirus and the risk of serious complication from the COVID-19. If the surgery requires usually the intensive care, then current availability of the intensive care bed should be considered as a part of decision-making process. In such situation, where neoadjuvant surgery is available but not routinely used in early stage, like early stage breast cancer, may be offered neoadjuvant therapy. However, it is important that neoadjuvant therapy or immunosuppression requires the clinical visit is also associated with the infection of the COVID-19. So it is important to discuss all the pros and cons with the patient and attendant before taking any decision. So there is again the COVID-19 guideline has modified some chemotherapy regime also. The regime can be increased or decreased, or friction, hyper or hypofriction also be done. In that way, the radiation is also done some adaptation where we can increase. Usually, the radiation is hyperproportionate and little bit of more doses. So again, in the summary, we can say this: the European the guideline that was prescribed by the European Center for Disease Prevention and Control and WHO has also applicable for the cancer in the COVID pandemic. So what to do? now it's coming to the how to prevent this thing, infection, COVID infection, or what are the measures we have to take for a cancer patient. Cancer patient should clean their hand very often. They wash their hands with the soap and water. If the soap and water is not available, have to use an alcohol-based hand sanitizer. Avoid contact with the sick people. Avoid touching the face, nose, and eyes. Avoid meeting or events or social gathering. Practice social distancing of 2 meters. So, what are the different symptoms that can be there, we have? For that we have to be worried, or like by which symptom we can recognize there is a COVID infection or chances of COVID infection. That is the cough, fever, sore throat, difficulty in breathing, muscle pain, and tiredness. If any patient has such type of syndrome, they should telephone a doctor for the consultation. Again, all patients with the cancer, if they should call the doctor or national health care services when they return from a risk region, or after contact with an infected person, or when the patient feels such above whatever the symptom we have mentioned earlier with the COVID-19. Do not directly go to the clinic or hospital, or as there is a chances of potential spread of the infection. Telephone a clinic first, doctor clinic first, or hospital first, and follow their instructions. What are the responsibilities of the hospital or healthcare professionals? In this COVID pandemic area, our healthcare is based on evidence-based medicine and patient-involved care. Additionally, the cancer care professionals are recommended to liaise the local administrator to set up the action plan or proactive action plan for especially the COVID-19 patient. Together with the local administration, we have to make 2 units for cancer treatment and one of the non-cancer treatment. Explore the telephonic or web conferencing capability of consultation in a stable patient. Then, supposing the patient having the flu-like syndrome, then we have to do the telephonic trials based on the previous day call. Suppose a patient having the flu-like syndrome, they have to call 1 day back, and after the 1 day they should go for the clinical advice to the patient. And again, the chemotherapy or radiotherapy can be modified, like hypofractionate or hyperfractionate, so that the patient used to get less visit to the hospital. Again, we have to remember this thing: if the weightage or need of the therapy is very much important or can modify the quality of life or survival, then we should not delay the therapy for such patient. Especially the patient caring or patient caring should be done in especially individualized vehicle or privatized vehicle, so that the patient get less social exposure, less exposure to the other parent. So self-isolation, self-distancing, social distancing are the cornerstone of such treatment of care. So we have to develop a psychological and multidisciplinary team for such care of such patient. Thank you.